Today we're talking about mitral valve prolapse. These are a few names they go by: systolic click murmur, floppy valve syndrome, Barlow syndrome, myxomatous mitral valve. The definition of MVP occurs when the valve between the left atrium and the left ventricle doesn't close properly, and the leaflets of the mitral valve bulge or prolapse upward or back into the left atrium.
This can lead to mitral regurgitation. Signs and symptoms include racing or irregular heartbeats and arrhythmias, dizziness or lightheadedness, dyspnea, which can be exertional or at rest, fatigue, chest pain, which is not caused by a heart attack or CAD, cardiac auscultation. One may hear a clicking sound as the valve leaflets billow out, followed by a murmur resulting from blood flowing back into the atrium. There is acute and chronic. ECG changes that you'll see include normal ECG in asymptomatic patients, arrhythmias, SVT, PVCs, and VTAC, T-wave changes 40 to 60% of the time, and it can be inverted or biphasic. You will find echo findings which include the presence of MVP in plaques and apical 3, anterior MVP, plaques views, NVL past annular plane of greater than 2 centimeters in apical 3. The mitral valve leaflets past the annular plane is greater than 1 centimeter. In posterior MVP, you will find it in views which are plaques and apical 3. Mitral valve leaflets past the annular plane of greater than 2 centimeters is diagnostic. You will find mitral valve leaflet thickening and redundancy or elongation in plaques, and you will also see it with NVL thickness greater or equal to 5 millimeters in diastole, which is considered redundant.
Some secondary signs you'll see is left atrium dilation, left ventricle volume overload pattern, making the left ventricle hyperdynamic and dilated due to underlying causes of MVP. There's a few color Doppler, power Doppler, continuous wave Doppler, and complications. Progressive MR, CT rupture, systemic emboli, pulmonary edema, among a few. Some treatments for MVP are i.e. prophylaxis, beta blockers, antiarrhythmic agents, and anticoagulative agents. You can make a few simple lifestyle changes: eliminate caffeine, alcohol, and smoking. You'll know it's necessary to replace the mitral valve when mitral valve area is greater than 1.5 centimeters squared, with an ejection fraction of less than 50%, and again, a pressure cuff time of 55 millimeters of mercury.